how do you explain shockwave therapy to your patients? As you know, my name is Paul Hobrough, and I'm doing these videos to try and help other clinicians just develop a little bit of their shockwave knowledge. Here, we're talking about how we introduce shockwave to our patients, because not everyone has heard about it yet. Unbelievable, I know. So how do you introduce it? Most people, most clinicians will talk about the energy levels, the energy flux density, the power of the machine, not what the patient's interested in. The patient wants to know what it's going to do for them. So just like when you want to hang a television on the wall, what you really want is a hole in the wall. You know you're going to use a drill, but you're not interested in the drill itself. You're interested in the hole it's going to make in the wall. So what is shockwave going to do for your patient? So here's some of the things I like to say. When someone says, what is shockwave therapy? I say it's a healing modality with an 82% success rate that literally spurs your cells into life to regenerate and to fix the tissues, the target tissues that need to be fixed. And it's got some really good science behind it, which supports the fact that this cascade happens in the human body that speeds up your rate of healing. In many cases where a body is injured, you can actually almost stop your healing mechanisms. So shockwave is like a defibrillator onto the body's healing system to kick it back into action and actually accelerate the rate at which it heals your tissues. There, it's quite a nice way of explaining to a patient what happens. It's backed in science, it uses a bit of analogy, and it develops the patient's understanding of what these two great pieces of equipment do. Now, what about when we try and differentiate between the EPAT or RPW, radial shockwave, and the focus machine? So what we need to think about here is the fact that the radial device is superficial, but it has a vast spread of the treatment, which is really useful when you're trying to treat a large area like a quadriceps muscle. Whereas the focus machine does exactly that. It focuses on those target tissues, but it's able to get deeper and it's a more powerful treatment. So with the focus machine, the numbers that it says on the machine are being delivered to those target tissues at the right depth. With the radial machine, the greatest energy that it says on the machine is hitting the skin, has a half-life, and therefore the actual energy that reaches the deeper tissues is much less than it says on the tin. But they both have really good applications. One, we can cover a large area in quite a quick period of time, and it will go to kind of 40 mils, so that's good enough to even do the shallow quads, certainly good enough for plantar fascia or Achilles tendon, but you are losing some of the energy. And yet the focus device, which is also known to stimulate and differentiate your stem cells, which is a level up in the radial device, you do get that energy deeper in. So if you were going to use it perfectly, we'd use the radial in the surrounding tissues that lead into that pathology and focus on the pathology itself. So I hope that's been helpful. What do you do when you explain shockwave therapy to your patients? You can write that in the comments if you like. Keep listening.